like dental health. It is something that matters to all of us, and you can call me Dr. V. As you guys know, I'm very excited to be here with you all today. Let me tell you a little bit about myself. As you guys know, I'm a board certified periodontist, which means I'm specially trained in taking care of gums and bones that support our teeth. I'm also skilled in dental implants and oral surgery. As you guys know, I'm a part of the American Academy of Periodontology and American Board of Periodontology. That's just a fancy way of saying I work with a group of dentists who are experts in gum health. I started ToothHQ Dental Specialists, and we have 4 offices in the Dallas-Fort Worth area in Texas. We are all about making sure your teeth and gums are healthy and strong. Now I'm here for you. I would love to hear any questions you might have about your teeth and gums, and you can ask your questions live here right now, or even send them for in our next show. Your questions really help us make these shows very helpful, not just for you, but just for everyone watching this show. And one more thing, if you like what you see here, what you learn here, please let us know. Your feedback is super important to us, and don't forget to like and subscribe to our channel so you won't miss out on any of our latest and greatest updates and helpful tips for your dental health. And I'm looking forward to talking with you all tonight and answering any questions you may have. And let's make our smiles as best they can be.
Perfect. All right. Very nice.
Okay.
Alrighty. So our first question sent in. It's been 6 days since my wisdom tooth extraction surgery, and I still can't feel anything on the left side of my lower lip and chin. I also have very limited range of motion. Is this normal, or should I be concerned?
All right. So you have 2 things going on. One is the numbness, and then the limited range of motion that you are saying. So let's talk about the easy item first, which is the limited range of motion. You're having some limited range of motion. What that means is not able to either open your mouth wide like this or going side to side, which is completely normal. Even if you have a lot of stiffness around the jaw, like it is going to take its own, Mother Nature is going to take its own course of time, and it is going to eventually get better, which sometimes may take up to 6 to 8 weeks for you to completely feel normal. I don't think there is any cause for concern for the next 6 to 8 weeks. And if you do have any concerns after 6 to 8 weeks, you can definitely talk to the surgeon who did the procedure. Second item, the numbness. The numbness, again, after having numbness after 6 days, sometimes it could be normal, because when you have a tooth that is sitting very close to the nerve, you may still experience some numbness, and that is not uncommon either. So if you start to experience, or if you are experiencing numbness after 6 to 8 weeks, and again that could be a cause for concern. If it is 6 days and if you have not had a chance to talk to your surgeon, then talk to them. And sometimes what we do as surgeons, we put you on certain type of medications, like usually steroids, and also put you on some kind of a vitamins to help to fasten or expedite the nerve healing process. So if you haven't done so, talking to the surgeon, talk to them, and definitely they should be able to help you. So to wrap it up, 6 days after the procedure, having limited range of motion and having some numbness is not unusual, and it's not uncommon, but still I recommend you talk to your surgeon about that.
That's right. Go see your doctor.
Mm-hmm.
Alrighty. I'm a 42-year-old female and a teetotaler, but I've been struggling with chronic bad breath. Could this be a sign of an underlying oral or overall health issue? What should I get checked? What is a teetotaler?
People who do not drink.
Oh.
Yeah, so I think it's probably like, it's one of the terms that they use overseas. I think it may be a person who was posted this question from overseas. So chronic bad breath for somebody who does not drink I should say it's not uncommon, but however, it is still possible that you may have other underlying causes. So one, let's look at all the causes for the bad breath, right? Before we give you an answer, right? Because you already asked about the whether it could be an overall health issue, which is absolutely true. So the causes for the bad breath are gum disease or dry mouth, which could be caused by just from mere dehydration or from taking a lot of medications, like for example, who take medications for high blood pressure or diabetes or even depression or anxiety. It is not uncommon for you to be experiencing any type of dry mouth, which could eventually cause the bad breath. And one of the most common things, like people forget, that is the GI issue. So either you could have some kind of an ulcer or other type of like acid reflux or any other type of GI issues, which is also one of the main causes for the bad breath. So going back to your question on could that be an underlying cause of overall health? Absolutely it is. Although you may not drink alcohol, it could be a variety of issues starting from the medications that you take, which could be causing causing dry mouth and causing the bad breath, or it could be the GI issues. So the answer is talk to your dentist first to see whether you have gum disease, and if not, and if there is any underlying overall health issues, then the dentist will be directing you to see your physician for that.
All right, absolutely. Hopefully that helps you dwindle down what it could be. Doctor, I recently had a filling in a wisdom tooth, but my bite still feels off. Is it okay to proceed with getting a crown on the opposite side, or should I wait until the bite is properly aligned?
So the first thing, getting a filling on a wisdom tooth, it's not like normal for you to get a filling on the wisdom tooth. Like, I'm not saying it should not be done or cannot be done, and normally that's not the common practice in the US. And I saw a patient actually today. Patient is 2018. Remember Kayla?
Oh yes.
We saw today.
24.
So Kayla's 24, right? So she was sent to our practice, and she had one tooth removed on the top right side already because of the cavity, and then she had 3 other wisdom teeth, one on the top left, one on the bottom left, and one on the bottom right. And the dentist sent the patient here because of the cavities to have all her wisdom teeth removed. Although they were fully erupted, what that means is the teeth have already come through all the way into the mouth, and we do not recommend routinely doing a filling on the wisdom teeth, just for the mere reason when you keep your wisdom teeth, like you end up it's not a matter of keeping your wisdom tooth, whether the wisdom tooth is going to end up causing damage to the tooth in the front, which is one of the main reasons. So going back to your question, if it is possible, my recommendation would be for you to get the wisdom tooth removed. But if your dentist or your surgeon is absolutely dead against removing the wisdom tooth, can you get a filling done for wisdom tooth? Yeah, possible. And if you have any bite issues and if you have any issues with the opposing tooth, again, sound like you're giving me all the reasons to why you should have the top tooth removed as well as the bottom tooth removed, not just those. And if you have wisdom teeth on the other side, get them all removed and then be done. Be happy for the rest of your life is what is my recommendation. But going back to your question on getting a tooth filled on the bottom, and if you have any bite issues on the top, get both of them looked at the same time and have a filling or a crowns done on both the top and the bottom. That's what my recommendation would be.
That's right. And that's what most of our patients do here.
Perfect. That's exactly what I was going to say. What did you recommend? What did we do for Kayla?
All 3 in a bone graft.
3. Yeah. Right, there we go. Perfect.
Okay, perfect. Dr. V, I'd like a second opinion. What is the standard treatment protocol for a horizontally fractured root at the cervical level in a front tooth that already has an old crown and a previous root canal? Should I read it again? Did you get that?
Yeah, I did. All right. I was paying attention, ma'am.
Oh no, because I stumbled, so I didn't know.
Okay. All right. So, what whenever you have a fracture of a tooth, is it possible to fix that fractured tooth? Yeah, it is possible. But when it is fractured beyond the degree whether salvaging is an option or not, and that's what we are talking about. So what we are talking about is, imagine a tooth that is completely broken. And I don't know how well you guys can see it. This actually is a model of a tooth which you have like a broken, or not broken, a prepared tooth, which is very, very tiny. But even smaller than that, you have a stump that is just completely broken at the gum line, what you're talking about. So when you have a tooth that is completely broken at the gum line, and years ago, and this I'm talking about like 25, 30 years ago, we used to die hard to try and salvage the tooth at that time, because that is the only option that we had available. We used to do root canals, and then we used to do crown lengthenings, and then now you got a tooth that you're able to put on. Now after all of this, then we got a big mismatch, because we got to push the gum line up on the fractured tooth, and one tooth looks normal and then the other tooth looks like really long because of all the procedure that you have to go through. But now with the technology that we have available, which is the dental implant, it is very easy for us to extract the tooth, put an implant right away, and even put the crown on the same day, and make the smile appear as natural as it can be. So that's what the technology can offer. So based on what I'm hearing from you, if you have a tooth that is fractured at the cervical line, which means like it is at the gum line, my recommendation would be to remove the tooth and replace the tooth with the dental implant. However, having said that, is it possible to do alternative treatment? Yes, it is possible to do an alternative treatment. The other one would be to remove the tooth and do a bridge, like cutting the two teeth on either side, again, which is not my recommendation. And the third and the last option would be, or one other option would be to do the root canal and then the crown lengthening, and then you can have a crown on the top of that with the guarded prognosis, which means you can't really, or you really don't know how long this tooth is going to last. And then the other option is just leave the tooth alone. You risk risk infection, because you're going to leave a fractured tooth in line in the mouth, and then you can get a flipper, like a flipper tooth on the top of tooth. You can wear on the top of a fractured tooth right there, so you can do that too. But you run the risk of infection.
That's right. We don't want to go that route, but so many options.
Absolutely, yeah.
Okay, before we jump into the comments, I'm 26 and my lower wisdom teeth, once thought unlikely to erupt, have now come in, one sideways and the other causing pain. Years ago, I was told they were close to the nerve and 3D imaging was recommended. Now, removal seems risky due to nerve proximity. What are my options, and how risky is extractions at this stage?
Well, age 26 is absolutely not definitely risky. So I'm not sure, why how well or how deep your teeth was impacted, and that's the reason why they said it is a little risky. Or did you really go see an oral surgeon who even said that it is risky for you to have the tooth removed? You also saying now years ago, so I don't know how old you are. We normally recommend getting the wisdom tooth safely to be removed before age 40 or 35. So I really don't see a reason why you should not be able to get the tooth removed. Again, I can't comment without seeing your x-rays, or you already mentioned 3D imaging, what we call it as a CBCT. So if you are concerned about the proximity and you've been told by your dentist that the nerve is proximal to the tooth is proximal to the nerve, my recommendation is for you to go see an oral surgery office, that is what we do in our office, or go see an oral surgeon, and they should be able to recommend whether it is the right treatment. Even if the tooth is completely proximal to the nerve, sometimes we able to either able to fully remove the tooth safely, or sometimes we section part of the tooth, what we call it as a coronectomy. So we remove part of the tooth and then leave the root which is proximal to the nerve, we leave it there, and you're going to be absolutely fine, even leaving a part of the tooth inside. So my recommendation, you already have the right answers to get the CBCT or the 3D imaging done. With the 3D imaging, you can definitely go talk to your surgeon locally in the area, or if you happen to be in the Dallas-Fort Worth area,
come and see us.
Come see Miss Shai.
Come and see me.
Awesome.
Yes. Alrighty. Hi, Dr. V. I'm 31 with impacted wisdom teeth on both sides, causing slight jaw misalignment but no pain. My dentist warned of nerve damage and losing my last molars during extraction, so I've decided to delay it. Am I right to wait, or should I reconsider even without pain? Oh.
So, no waiting is the answer. You already gave me all the right clues, and you already have damaged the tooth in the front of the wisdom tooth, which is one of the most common reasons. For example, if you have what we call it as a lower right second molar, you have a lower right third molar, which is kind of pushing against the tooth in the front. And the second molar is the one, what we call it as a chewing molar, is the one we really want you to keep. And that is one of the number one reasons why we recommend removing the tooth or the wisdom tooth on the back, so that way that does not cause damage to the tooth in the front of it. So waiting is not going to really help you. Even if you have the tooth was sitting close to the nerve, there are still possible options. Either the tooth can be very safely removed in a surgical office like ourselves. We should be able to safely remove that. Or even if it is not completely safe for you to remove the whole tooth, we remove part of the wisdom tooth and we can still safely do the procedure to salvage the tooth in the front. So no more wait. Go see the oral surgeon, or come see one of the surgical offices like ourselves, and we definitely can help you.
Perfect. Absolutely. Come and see us if you're in Dallas.
Mm-hmm.
So it is time for our live questions. Thank you guys so much for sending in comments. Hi, Giselle Hart. Giselle says, hello there, Shai and Doctor.
Mm-hmm.
Please let me know if SLS that causes my gums to peel off can cause my gums to recede, or can using a crest white strip for 9 hours overnight a few times cause recession on my lower front teeth. It was 15 years ago. If acid reflux can destroy enamel that is stronger than... I think there's so many questions. I think she has 3. Okay.
Okay.
Alrighty. So we'll start with the first one. Please let me know if SLS that causes my gums to peel off can cause my gums to recede.
Absolutely. So whenever you have the SLS disease, it is not uncommon for you to have any type of damage to the mouth. The SLS definitely can cause damage to your teeth, and I'm hoping that she is referring to the SLS, meaning systemic lupus. Yeah, systemic lupus. And when it is like, it is going to cause damage to the mouth, and it definitely can cause some gum receding. And I'm not going to completely say or definitely say that SLS is the one that's caused the damage. First thing is, go with an open mind. Go see your dentist, or definitely see a periodontist if you're concerned about the gum recession. Make sure that there is no local factors, for example, such as the gum disease or tartar or a bite issue may be causing the gum receding. And on the top of that, you also have the risk of the SLS, which could be risking you even more for the gum receding. So first cause the local factors, and then definitely see whether how the SLS is contributing to your gum recession, and get it fixed. And easy fix, go see a periodontist. Yeah,
that's right. So she had multiple parts. So this was like a 2-part question. So can using crest white strips for 9 hours overnight a few times cause recession on my lower front teeth? It was 15 years ago.
White strips alone, I'm going to say, are not going to cause gum receding. However, if you had some gum receding that you had earlier, but now that you are starting to pay attention by putting in the strips on your teeth, now you're starting to pay more attention, it is very possible now that you are paying attention. Now that is the reason why you are starting to see the recession. Again, without doing a proper diagnosis, I can't really comment whether the crest white strip caused the damage. My gut feeling is crest did not cause the gum damage. You probably had some existing gum damage before. The simple answer is go see a dentist and see what they can do to help you.
Perfect. And her final question, if acid reflux can destroy enamel that is stronger than bone, then can acid cause gums in the front to pull back since it's gingival tissue and not as hard as steel?
Whether the acid reflux cause gum recession, what we normally see is acid reflux not causing direct gum recession. However, what's going to happen is because of the acid reflux, you're going to get a lot of erosion around the what we call it as the neck of the tooth, which is closer to the gum margin. Now, because you're going to start to see that erosion, if the erosion gets bigger and bigger, now it is going to push the gum away. So it may not be a direct cause, the acid reflux is causing the gum receding. However, the acid reflux can cause erosion of the tooth, which is going to push the gum away. So the simple answer is first make sure that your acid reflux is under control. Then go see the dentist, and the dentist can make sure that there is no cavities or anything on the gum erosion area. Then they can either work with, if you happen to be in the ToothHQ, in the Dallas-Fort Worth area, whether they can work with ToothHQ to get the gum receding fixed, or they can send you to a local periodontist to get the gum receding fixed.
Very nice. And I must say, Doc, what do you think? Shy and Doc, don't you like the fact that my name came first?
Thank you.
No,
Thank
my
you.
name came.
Yeah,
Okay.
Absolutely, yeah. They're starting to notice you as well.
I think they always did, actually.
Oh, they said your name first, not me.
Right.
Shy and Dr. V.
Exactly.
Maybe they said
After.
they did not even bring my name. They said Shy and ToothHQ.
Oh, no. Well,
Oh,
they said
they did.
doctor. They just didn't say
Doctor.
Vadivel.
Okay,
You know?
alright.
But they
Okay,
know
man.
my name. Thank you, Giselle.
Thank you.
I appreciate that wholeheartedly.
Thank you.
Absolutely.
Thank you, Giselle, for following us, and we really appreciate it so much. Yeah.
Absolutely. All right. So we'll jump back into our questions that were sent in. I've heard that citrus oil might help with dry mouth. My mom is going through menopause, and I've noticed she's been experiencing dryness. Does dry mouth during menopause increase the risk of gum disease? And what are the best ways to manage it and keep our mouths healthy?
All right.
Keep her mouth
So, multiple parts of the question. Number one, is dry mouth common during menopause? Absolutely, yeah. It is definitely common because of the hormonal shifts you have going through in your body. Just like any medication, like blood pressure or diabetic medication, cause some damage to your mouth and cause dry mouth. Definitely hormonal shift can cause some dryness in your mouth. And why does it happen? Because of the dryness, and you get some sticky feeling, and it can cause some increased plaque buildup, and it can cause bad breath, and all of these, and increase risk for gum disease, and all of that could happen. So why the dry mouth raises the gum disease risk for gum disease? Because the saliva is protective to flushing the bacteria away from the mouth. But because now you have dry mouth, there is not like a lot of flushing happening because of the saliva. So that puts you at a higher risk for gum disease and the cavities. So the third part of the question is, can the citrus oil help? Yes, absolutely, the citrus oil can help, but use it with caution and use it limited. Don't keep like loading up with a lot of citrus oil, because that can cause gum erosion or the tooth erosion. So how the citrus oil helps? Because it is citrus, because it is acidic. Whenever you put the citrus oil and the glands, the salivary gland starts to, or your mouth starts to secrete like a lot of saliva, and that now starts to flush the bacteria away. So that is how that is how the citrus oil helps. So what are the top things that you could do to help yourself? Stay hydrated. Use any type of chewing gum, which is like a sugar-free chewing gum. Try saliva, any type of saliva substitute. So you can buy some saliva. You can buy some salivary substitute like a mouthwash, like a spray to help with keeping your mouth moist. You can suck on some ice cubes and make sure to follow very strict oral hygiene. And then last but not the least, and make sure that you are going to go to your dentist on a more frequent basis because you have all of these problems.
Absolutely. Go see your dentist.
You got it.
All right. Okay. Hi, doctor. I recently had a front tooth filled, and during the polishing process, the dentist touched my gums. Since then, that area has been bleeding, and it looks like I may have developed gum disease. Is it possible to develop gum disease from a filling appointment?
Well, the answer is yes, you can definitely have gum disease. I'm not going to say it is a direct cause of you went to the dentist. It is very possible that you had some existing gum disease to begin with, and you probably had a cavity that is closer to the gum line, and then now the dentist worked on your tooth closer to the gum line, and now that aggravated the gum disease that you already had, but the dentist didn't have any choice because you probably were in pain or your cavity really needed to be treated to prevent any further damage. So I'm sure your dentist probably has given you a plan either to now fix your cavity which is closer to the gum line, followed by they probably have some plans to fix your gum disease also. So my recommendation is, although there is no direct cause and effect relation, the filling or the process of going to the dentist to get a filling done possibly could have triggered the existing gum disease. My recommendation again to follow through with getting the filling done and follow through with any other recommendations your dentist might have to control the gum disease. And if they have not talked about controlling a gum disease, talk to your dentist when you go to them the next time to follow through with controlling the gum disease so you get to keep your teeth.
That's right.
Mm-hmm.
Okay. Gum disease from a filling appointment.
Absolutely.
All right.
Yeah.
So it is time for a fun game. Are you ready?
Is it the same game that we played last time?
Yes, and you lost.
No, I
Yes,
didn't
you did.
lose. Yeah, I never lose. At least to you. How about that?
Always lose to me.
Yeah,
Yeah, you
okay.
always lose to me.
All right. Okay, man. All right, you got it.
Make sure we're on the same page there. All right, so we'll go ahead and get started. You ready?
Mm-hmm.
Okay, rules of the game. You have to answer in 1 to 2 complete sentences.
Okay. We'll try.
All right. I understand that brushing should start around age 6 to 8 months, but what about flossing? When should that begin?
As soon as the teeth start to come through. Can you brush and floss at 6 to 8? But normally people start around age 2 or 3.
Okay.
Okay.
All right. Dr. V, be honest with me. What toothpaste and mouthwash do you actually use? Oh, that's a good question. Let's be quick.
Anything with the fluoride on it, right? The real answer is, whatever my wife buys should be the real answer, right?
Shout out to Suda.
Right?
Okay.
So I think the last time she bought Colgate Total, I think that's what and then one more thing, kudos
You're
to the
losing.
reps.
You are losing.
Kudos to the rep, right? Whatever the reps sometimes give me some toothpaste to try and I use them
Oh,
too.
yeah. We do appreciate that. Travel
Yeah,
size,
thank you. Yeah,
Listerines.
right.
Bring them by.
Yeah.
Yeah, just bring them by. Okay.
And the mouthwash, right? Thank you. That's the mouthwash. Thank
Oh,
you.
well,
Listerine. You
yeah.
already said that, right?
Absolutely.
And Crest Pro Health.
Okay, so you got 1 out of 2 so far.
All right.
All
I'll try.
right.
I'll try. Okay?
Okay.
Because that's a tricky question about me.
All
right,
Supposed to get
okay.
like 1.
Yeah.
Yeah.
Okay.
Okay. Alrighty, doctor. When a patient is in the dental chair, where do you actually prefer we look? At your face, the ceiling, or should we just close our eyes? Which is ideal?
Do you know the answer for that one answer? One word answer? What do we have in the ceiling in our office?
A light.
No.
Oh, a TV.
There we go.
Oh. Oh, well, look at the TV.
Yeah, look at the TV. In our office, we have TVs up on the ceiling, so most of our patients look at the ceiling. Pretty much watch TV, get the work done. Come see us at ToothHQ. We can get the work done while you're watching TV.
That's right, and you can avoid the awkward eye contact.
You got
100%.
it.
Got you covered.
Yeah.
All right, let's jump back in. Hi, Dr. V. Have you performed? Oh, so you totally got like 2 out of 3.
2 out of 3. So I got 2 out of 3, which is a good one.
Yeah.
Yeah. Right. You can.
Oh, okay.
Yeah.
Yeah. Just a reminder there. Hi, Dr. V. Have you performed dental implants for patients who smoke? I'm curious how smoking affects implant success long term and if you've seen any complications firsthand. Would appreciate your insights.
Yes. Absolutely. You already answered it.
Yeah. I know the answer to this.
You know the answer. Okay, got it. Okay, all right. Okay. So, if we are being told in our medical or the dental community, do not perform implants on smokers, and we wouldn't be in practice at all. So, our goal is to be able to help as many patients as they come in and take them where they are, right? And smokers, people with diabetes, people with high blood pressure, people with multiple medical complications, people went through cancer. All of those are patients. Definitely, there is no real such thing as a real contraindication. And we call them relative contraindication, but we work our way through it and then still able to help those patients. But my recommendation is, what can you do to help yourself? If you are smoking a pack a day, cut it down. Or if you are a smoker and if you're still not able to cut your smoking level, then after you get the dental implant, become very diligent on your oral hygiene, or come and see us on a more often, maybe like every 2 to 3 months to get your cleanings done. And those are all the things. However, if you are a smoker, your risk goes a little bit higher on you're not being able to successfully get the implant, or the implants being successful. That's pretty much it. Other than that, you can definitely get the implant. And can you really successfully be able to chew with getting the implant? Absolutely yes. And just manage your oral hygiene and manage your dental visits accordingly to minimize the risk of losing the implants, pretty much.
Just quit.
Yeah. That's the best.
That's right.
Yeah.
Okay. What are the recommended oral hygiene practices for a 1-year-old? Is there a specific type of toothbrush and toothpaste that should be used?
I'm going to get out of my chair and show you something real cool.
Oh, I thought you wanted me to answer.
No, you can keep talking.
Totally awkward.
Keep talking.
Okay, well, guess you guys are babysitting me since he left. So, how's your day going? Thanks for joining us. What prompted you to join us today?
Oh, I wanted to show something really cool we have.
Is it the little finger toothbrush?
Yeah, finger toothbrush. Yeah. Man, I thought I had it here. I lost it. All right, very good. Okay, all right. So, pretty much, so when you have, either you have teeth or gum, it is definitely recommended. All you got to do is either, just use a piece of cloth or like a piece of gauze and to dip even the mouthwash, right? Mouthwash, and then you can just wipe off the teeth or the gums. And we have what we call it because babies can bite, so we have a finger toothbrush, and you can use that to brush your teeth. And then do not put a lot of mouthwash or do not put a lot of toothpaste on there, because babies cannot spit it out. So you have to be able to just have them spit. That is the reason why you put a cloth. So in addition to wiping it off, you can actually use that to soak it, and then that way the baby does not swallow. So those are our recommendations for people who are either teething or like a 1-year-old.
Very nice. Did they have them 17 years ago?
Oh, yeah. Absolutely. Yeah, absolutely. Yeah. Mm-hmm.
You know from experience?
I do. Yeah, absolutely. Yeah. And as a matter of fact, we do have some YouTube videos on that.
Oh, how exciting.
Yeah, how to take care of baby's teeth. Yeah, so watch our YouTube videos. Yeah.
Did you use an example baby?
No, I did not. But I did show some pictures though.
Oh,
how to use it. And I actually showed the picture of the toothbrush that I was looking for in my drawer. Yeah.
Did you?
Yeah.
It's probably up here. Okay. All right. Hi, doctor. I recently came across a viral post where someone mentioned that a dentist in USA quoted her $4,500 for treatment, but she ended up getting it done in Tijuana, Mexico for just $800. She also claimed half of the treatments recommended in the US aren't even necessary. Why is there such a huge cost difference, and what's your take on this?
Well, in the US, I'm not going to disagree with that. I'm going to say that I definitely agree that the treatment in the US costs more than any other part of the world because we follow the highest standard we can possibly. And I'm sure you probably heard it right, from other people. Not just dental care, but healthcare in just as a whole cost a lot of money because we follow a very high standard in our in the US, and that's the number one reason. And then in addition to that, there is like a lot of regulatory processes that we have to get through. We got to do like in other countries, if they have to follow 3 steps, we got to probably follow 15 steps or 30 steps to get through to the same procedure. So that is one of the number one reasons why the healthcare costs too much in the US, and that's one of the reason. And then there is no standard for you to compare. You can go to like anybody in Mexico, and matter of fact, we have some doctors who practice dentistry in Texas. You can go read the news, and right here it happened right down the street from here. There are some doctors who are practicing, the doctors from Mexico. They were are from overseas. They were practicing dentistry in their apartments, and one of the patient went there to get the treatment done. They could not complete the treatment. The patient got sent over here. We have been able to complete those treatment. However, to go back to your question, can the dental care cost less? Absolutely yes, because you are going to get like even the dentists, like they have to follow a different step because they're able to don't have to follow the standard of care that we practice in the US. They can definitely do the treatment for less money. And so the second part of your question, is it overdiagnosed? Again, I can't really comment. We do not overdiagnose in our practice. Overdiagnosis can happen. Again, it really depends on what you call it as an overdiagnosis. Sometimes we do a lot of preventive treatment. For example, when a patient comes to have, this is not uncommon for our practice, when a patient comes to have one wisdom tooth removed, and we recommend removing all 4. In your case, you may be thinking, oh, I do have a problem only with one wisdom tooth. Why are you overdiagnosing to get all 4 wisdom teeth removed? Because my recommendation is based on the preventive treatment or the prevention and how your mouth is going to look like if you're not going to get any treatment done in the next 5, 10, 15, 20, 30 years. So what you call it as a diagnosis could be like a preventive treatment is what the other dentist might have recommended. Potential risk of overseas treatment, I can't really speak, and I'm not going to make a blanket statement saying that all the overseas treatment are bad. And definitely I can say that you're going to be stuck to like a lower standard of care as opposed to like a higher standard of care within the US. As simple as what we call it as a sterilization protocol. They don't have to be sticking to the sterilization protocol in our offices. We in the US within US, the whole of the United States, and we have to even stick to the basic sterilization protocol which is regulated by the industry. So again, my take is I can only speak for myself, and yes, definitely it costs a little bit more, but you get what you pay for. We are going to definitely stick to the higher standard, and as treatment, higher standard of other regulations, including the sterilization protocol. Make sure that you are getting taken care.
That's right. I mean, come and see us, or you might end up coming to see us anyways.
You got it.
So, All right, so we're going to jump back into our live questions. Thank you guys for sending them in. Doctor, what's the best way to know if the pain is from my gums or tooth decay?
Tooth, if you have a tooth that is hurting, and normally we do have some certain tests that we do, we tap on the tooth to see whether you're hurting from the tooth. Sometimes it's a little bit like what we call it as a referred pain. Sometimes you have a tooth pain that is going to be referred to the gum. You may have some pain around the gum, or it's the other way around. When you have some pain around the gum, then you are going to have some referred pain onto the tooth, where it's going to feel like it is a cavity. But there are some certain tests that we do. For example, what we call it as a pulp testing or an ice testing we do to see whether the pain is coming really from the tooth, or we call it as a tap testing, which we are going to tap on the tooth to see where is it coming from. And for diagnosing the gum disease, what we call it as a probing, and we are going to use our measuring tool to go around the gums to measure how much of pocketing or bone loss or gum disease you have, to diagnose whether the pain is really coming from the gum disease. And then on the top of that, what we call it as a 3D imaging, or the CBCT, the CT scan, we are able to, a lot of times, able to tell, along with the CBCT and the clinical findings we have, whether the pain is really coming from the tooth or from the gum. So the real simple answer is go see your dentist to see whether the pain is coming from the tooth or the gum.
That's right. Go see your dentist. Reoccurring theme here. Doctor, is it okay? So we'll jump back into our questions that were sent in, but send in your live questions and we'll also get to those before we end tonight. Doctor, is it normal for crazed lines to extend all the way to the gum line? Should I be worried? I'm kind of freaking out. What's a crazed line?
You know?
No.
Okay. Okay. So crazed lines are, what we call it as a thin or like a micro cracks. You really can't see. So imagine like you have a tile. This is not uncommon for me to explain it this way to our patient, because you have a tile at your house, or like on a plain floor, on a flat floor, and you see like a small thin crack, which is very hard for you to even visualize, right? Those are what we call it as a crazed line. These are very minute cracks, so you can't really like sometimes see them, or sometimes you're able to see them, particularly under like a bright light, then you're able to see it. And normally we see that on the dental chairs because we put some bright lights on patients' face. So if the crazed lines themselves, it is not like a problem at all. And whether it is right in the part of the tooth or they extend all the way to the gum line, it does not matter. So you can have crazed line, and we have patients that are with crazed lines, and I've seen them forever, and then they stay fine. There is not a problem at all. However, crazed lines can get deeper than that. They can lead into fracture, particularly if you are a heavy clencher or a heavy grinder. So in that case, you are going to need a night guard anyway, or like a bite guard anyway. So make sure that if you have a crazed line and you have the habit of clenching or grinding your teeth, and if you have been given a night guard by your dentist, make sure that you are going to wear it properly.
Yeah. That's right. Okay, so check out those crazed lines. Doctor, are there any oral diseases that can be inherited? Yes.
The answer is yes. Yeah, Shai answered it. And what are those? Gum disease, right? Yeah. Gum disease, cavities. Sometimes we call it as a, like the tooth does not form well. Like, for example, there is a disease called amelogenesis imperfecta, dentinogenesis imperfecta. So meaning imperfection in the formation of the tooth. This can happen. And then like even some crowding, like, what we call it as a malocclusion. So crowding, if mom and dad have crowding, it is very possible you may have some crowding also. And then some of the conditions called, like we call it as a cleft lip or the cleft palate, meaning you may have a cleft in the lip or you may have a cleft in the palate. That can happen also from genetics. But the cool thing is the things that you can overcome, which is gum disease and the cavities. I always joke with my patient, hey, don't blame it on the mom or dad. So don't do that, because there are some genetic predisposition, but you can really overcome. For example, gum disease is very easy. Cavities is very easy. All it matters is practice good oral hygiene. Make sure you're going to go see a dentist or come see the periodontist, and we can take care of them for you.
Absolutely. Okay. So we're going to jump back into our last live question of the night, you guys. But definitely still send in your questions and maybe we'll answer it next time. Should I be worried if my child's baby teeth are coming in crooked? Talk about denta imperfecta.
Oh, the teeth coming in crooked and the dentinogenesis imperfecta are two different things.
That's what I said. Oh.
They're two different things.
Oh, don't confuse the audience, Dr. Vadivel.
Okay, all right. You are confusing, not me.
I was right.
Okay, all right.
Remember,
okay, all right.
Shy and Doctor.
Shy and Doctor. Okay, thank you. Thank you for reminding me, Miss Shy. Okay, all right. So, should you be worried when your child's teeth are coming in crooked? Absolutely, you should be concerned, because earlier during the show, we were talking about what is the right age for you to start flossing, what is the right age for you to start taking your baby to the dentist, which should be as early as like about age 1 or age 2. So if you are going to see your dentist or your pediatric dentist, they are going to recommend if your teeth are coming in crooked. The reason they may be coming in crooked is because you may have some extra teeth, which is not uncommon, or some of the teeth fell out early. Now the teeth are going to start to come in crooked. That is possible also. Just like Shai mentioned earlier, dentinogenesis imperfecta or the amelogenesis imperfecta or any type of genetic disease, if they are coming, if you have any of those genetic diseases, it is very possible the teeth are not fully forming, and that could be causing some crowding also on your teeth, on your child's teeth. So the bottom line is, the earlier that you can take your child to the dentist or your pediatric dentist, which is age 1 or age 2, is the best thing that you can do. Even if you are going to take them later than the age 1 or 2, still talk to your dentist or the pediatric dentist to see and ask them for the reason for the crookedness or the crowding, and they should be able to help you.
That's right, and thank you for confirming I was correct.
You are correct.
Yes, thank you.
Shai is always correct.
Gosh, Dr. Vadivel, you're doing so well today.
All right, okay. Am I going to get the kudos?
Oh, kudos.
Thank you.
You're listening.
Okay.
Wow, see what happens when you...
Okay.
All right. Doctor, I recently read an article about a dentist who recognized that a patient's jaw wasn't a tooth issue. It turned out to be an early sign of a heart attack, and the dentist immediately referred him to the ICU. Is that really possible? How can you tell when jaw pain is dental and when it might be something more serious like a heart condition? Oh, not body connection.
Yeah. So, we talk about it all the time, right? In our office, and how the dental conditions can be related to the other parts of the body. So one of the most common thing that happens during a heart attack is you're going to start to see, the whole side of the face, or whole side of the face and the body, you're going to get to have some pain. And when you have the pain, particularly going into the shoulder on the left side of your body, where you're going to which is not uncommon during a heart attack, and you're going to have the pain possibly radiating to the jaw also, and that is very possible that is one of the reasons why. And not the dentist just diagnose or looking at the jaw pain, it is not the jaw pain, and you need to go see the doctors at the hospital or send them to the ICU. However, he possibly might have noticed other conditions, such as patient blood pressure was high or the heart rate was high. The patient was really just getting some chest pain also, but it was possibly mild. The jaw pain was more than the chest pain, so that is one of the reasons why. And the thing is, when you have the jaw pain and when you have a chest pain, I'm just sending you to the hospital first, because a chest pain is not something that can wait. But can the jaw pain wait? Absolutely, it can wait. So if you have a priority, then have the chest pain taken care and go see the people at the hospital or the emergency department. And after that gets settled, then come see us and we can definitely take care of the jaw pain.
That's right.
Priority.
Jaw pain, yeah.
Priorities.
Jaw pain, us. Heart. Hospital.
Hospital.
That's
Okay.
right. Okay. Dr. V, I've been dealing with early stage gum disease for the past few years, and I'm currently undergoing non-surgical gum therapy. I do enjoy the occasional donut, but I'm concerned. Could the sugars in the donut negatively impact my gum health or slow down the healing process? Yes.
We all have life, right? You got to eat what you got to eat, right? And so,
did you eat the cake?
I did. You spoiled me with 2 pieces of cakes.
Was it 2 pieces?
Yeah, no, more than that. More than that, right? But did I tell you, right? Like I told you, I shared it with the family.
Oh.
Right. Okay, all right, okay. Right. So, by the way, I do have a sweet tooth, and I do have a sweet tooth, I admit, but I will make sure that I'm going to brush my teeth after waiting for like a minute or 2, and you see me doing that. Go in the bathroom, right?
Yeah.
Right, okay. So, I brush and floss after each meal and after each snack. My kids go the same way. Daddy, how can you do that? You just now ate, and how can you go to the bathroom and brush your teeth, right? But that's kind of my habit. That's the way I take care of my teeth and gum. So to answer your question,
there.
Yeah, right. That's standard of care, right?
Yeah.
All right. So if you have early signs of gum disease, my recommendation is, so can the donut can the donut make your gum disease worse? Absolutely. When you have sugar attracts bacteria. The bacteria can make your gum disease worse, and that's one of the reasons why we would say, yes, do not eat a lot of sweets, right? Because it can make your gum disease worse. However, if you have early signs of gum disease and if you have a sweet tooth, then control the gum disease so you get to enjoy your sweets, right? So then you're not going to have the real adverse effects or real bad effects of the sugar when you don't have gum disease. So, want to enjoy your life? Prioritize, right? Take care of your gum disease and
eat your donut.
You got it. Thank you.
Or come see us?
Yeah, come see us.
Oh, okay, both of them. Yeah.
Come see Shai. She can give you a piece of cake now.
I'm not sharing any more cake.
All right.
Yeah. That was the end of that, buddy.
Happy birthday. Belated.
Oh, stop.
Belated.
No, don't tell the world I'm a
Belated.
year older, Dr. Vadivel.
Okay. All right.
Oh.
Belated wishes.
Oh, thank you.
Belated 16.
Exactly. Thank you.
Thank you.
Yeah. 21, but thank you.
Oh, 21.
Yeah.
Okay. All right. Okay.
Yeah, that's what we're going to tell them. Alrighty. I'm 69 years old and have Medicaid. I take medication for arthritis and high blood pressure. How often should I go for a routine dental checkup? And will Medicaid cover these costs? Yes.
Okay. So how often they should go?
Well, if you have perio, at least once every 3.
You got it. Okay. All right. So for 69 years old, my recommendation is whether you have, periodontal disease or a gum disease or not, my recommendation is to go see a dentist every 3 months. Is the Medicaid going to cover every 3 months? Possibly not. My take on that is, this is what I tell patients. This is a typical spiel I give them. So, even if you do not have insurance, let's say for discussion purpose, a typical dental cleaning costs anywhere between $100 to anywhere between $200 to $250, right? Let's say $200 on an average. So you paid for a cleaning 4 times a year, anywhere between $400 to $800 per year for 4 cleaning with no insurance whatsoever. And if you paid, let's say, $400 to $800, and you paid them for 5 years or 6 years, but $3,000 to $5,000, that's the cost of a single dental implant to replace one tooth. adds you to lose one tooth over the period of about 3 to 5 years or 5 to 7 years, right? That's my take on it. Can we help you save a tooth over a next course of 5 to 7 years? Absolutely yes. That is my take on it. So if you are 69, go see your dentist every 3 months to get your cleaning done. They can definitely help you save a tooth. And even if the Medicaid does not cover, my recommendation is to pay out of pocket to get the work done. And more than likely, Medicaid is going to cover part of that. More than likely, if you have some kind of a supplemental coverage, Medicaid is going to both those supplemental coverages are more than enough to take care of your cleaning. Talk to your insurance company and find a dentist going to help you. And if you happen to be in the Dallas-Fort Worth area, come see us. We do a free consult for Medicaid patients.
That's right.
We can definitely take care of that for you.
Absolutely. Okay, you guys, we are coming to an end, and we'll answer a few more questions. Doctor, are over-the-counter whitening strips safe for teeth? My teenage daughter uses them about every 6 months, and I just want to make sure they're not causing any harm.
Absolutely. Over-the-counter whitening strips are very, very safe to use, and if they are not safe, and we wouldn't be selling them over-the-counter anyway. Using them once every six months is absolutely normal. Like you can use them even like every week or every month or every couple of months you can use them, as long as you follow the manufacturer recommendations. I don't see a problem at all in using any of the over-the-counter whitening strips, and then again follow the manufacturer recommendations and do not mix and match between different brands. Then you may kind of lose track on the manufacturer recommendation. As long as you are going to stick with the same brand, follow the recommendations and how often you can use them, and I don't see it as a problem at all.
What about cavities or teeth sensitivity?
Well, again, manufacturer recommendations are they are going to say that if you have a cavity, do not use them, and if you have a sensitivity either before or after using them, again, they are going to recommend to go see a dentist. Again, going back to the manufacturer recommendation, make sure that there is no cavity and then there is no sensitivity. Good
I didn't
one,
know
though.
that was on the box. Okay.
Absolutely, yes. Yeah.
Read the box. Alrighty, very nice. Last one for the night.
Okay.
Doctor, aside from gum disease, are there other conditions that can affect the gums?
Absolutely. Many conditions can affect the gums, and we call it as a gum overgrowth, what we call it as a gingival hyperplasia, or sometime when you have white or red patches in the mouth, and which we call it as a lichen planus or a leukoplakia, that can affect your gums. And then we call some growths around there is some growth that can appear around the gum, what we call it as the cyst, or like a granuloma that can happen around the gum tissue. And then also like a lot of hormonal deficiency or hormonal stuff can affect your gum tissue also, that can cause some swelling of the gums. And so the bottom line is, like, in addition to the gum disease, there are several things that can go wrong with your gums, and if you happen to have any of those, or if you're concerned, go see a dentist or a periodontist.
Or us. Come see Shy and Doctor.
Shy and Doctor at ToothHQ.
That's right.
Thank you all for being a great audience tonight, and we so look forward to seeing you guys next time, and bye for now.
Okay, we actually started that one on time.
Yeah.
Okay. Alrighty. Well, I'm going to take this stuff out my